I said maybe I could stream an operation live, watching in real time onto people's smartphones, and see if I can scale it around the world. Because one of my thoughts is always, how do we share knowledge on a much more global scale? How do we scale up education?
Today, Future Medicine AI is chatting to a cancer surgeon turned futurist, Dr. Shafi Ahmed. He's been in the medical industry for decades, exploring how tech and AI is changing the way healthcare is delivered. Dr. Shafi, what was the moment your journey changed direction?
So I think I can take you back to the spring of 2014, when I think my career changed into a different trajectory, and because suddenly the technology became available. So my moment of change, you call it the kind of, that kind of one moment of my history, if you like, that transformed my life into going from a jobbing surgeon, an academic surgeon, a professor in a cancer hospital, to becoming this kind of tech futurist person that I didn't really think I was going to become, but it's kind of come my way. And that was the introduction of the Google Glass. And so Google Glass was an augmented reality smart glass that was launched by Google around 2012, 2013. And I got hold of one of the earliest examples in the UK in 2014 from a guy who used to work for Silicon Valley Bank, who invested in Google, and he bought one over for me from Silicon Valley early. I remember walking around the streets of London with a Google Glass before anyone had one. And people had heard about it, you know, and the British public were great because, and I kind of categorized into three groups. One group were ignoring you, like good British kind of, you know, traditional ignoring people as they are. Another group would look at you and stare at you endlessly. A third group would come and say, hey, what's that? Show me what it is, etc. So there are three parts of this conversation. On the buses, the trains, I walked around the streets with them. And it was really interesting to see how people's perception was. And for me, the thing that changed was trying to work out the utility. Yes, it's a gadget, it's technology, but what's the utility? How can we use it to either do something differently or better? And so, of course, my also experience is in education. So I was Associate Dean of the Medical School for about 10 years, teaching undergrads for a long period of my life. So when the Google Glass came out, I said, maybe I could stream an operation live, watching in real time onto people's smartphones, and see if I can scale it around the world. And when we did the very first experiment with this, I did a live transmission of an operation. It was a patient with cancer. And so we did a live operation in real time, streamed to students and trainees across the world. And I hadn't realized how effective that would be because we were just experimenting. It was a thought exercise. Can this be of use to us? And it went absolutely viral. I think 14,500 students or trainees in 118 countries simultaneously were in my operation, interacted with me on the smart glass. And what they could do on their smartphones, they could actually put a little message in, text a message, which would appear on the bottom of my glass immediately. So I could look at it, answer it, interact with the people that were watching the operation in any parts of the world, and carry on. It just showed that thinking outside the box, the technology could actually democratize education, share knowledge on a wider scale. Because one of my thoughts is always, how do we share knowledge on a much more global scale? How do we scale up education? Historically, we can teach one person. That's great. One person at a time, it's effective, and there's good engagement face-to-face. You can then interact with the classroom, 20, 30, 40 students, or an entire audience of 100 in medical school, for example. It depends in lecture theatre. So that's at the scale of what we had opportunities before. Suddenly, using just a bit of connectivity, 3G, 4G connection, a smartphone, which is ubiquitous, and a smart glass, you can now reach people around the world. I'll share one story with you. When I was doing these operations, I remember getting lots of messages from various parts of the world. And one girl called Ella got in touch. And she said to me, "Oh, thank you, Professor Ahmed, for doing these operations. I'm really enjoying them. And I'm a medical student on the Marianas Islands." So the first thing was say, where the hell are the Marianas Islands? So I then went to Google Maps, and I had to, if you look in the middle of the Pacific Ocean and you zoom in a few times, there's a small little island called the Marianas Islands, population of about 10 to 20,000 people. So I was connected with her using my smart glass, teaching her remotely. And I remember that was really quite colourful in the sense that it showed the ability to connect human beings. And that led to me thinking about the whole concept of connecting a billion minds. And I think that Peter Diamandis, who's a futurist in the US, he talks about this whole concept of saying to make $1 billion, you help 1 billion people, right? You become a billionaire, from a commercial perspective. I took that and said, actually, let's turn its head. To help 1 billion people, you just need to connect 1 billion minds. And that will make it much more powerful in terms of sharing knowledge. And that was one of the TED Talks I gave around connecting 1 billion minds. So that's where I thought I changed, because suddenly I found the utility. The use case was good. It scaled, it went viral, and people were seeing the kind of positive aspects of using technology.
It sounds like you just had this moment of where teaching and tech sort of joined together perfectly. And just on that, so now with this glass, are we actually sort of seeing that play out in universities now on an everyday basis, for example?
I think the thing that's changed our civilization and society is COVID. In 2020, in March, when COVID came about, people suddenly realised that we had to be more remote. We had to try to connect with one another and use technology as the interface. Prior to that, medical consultations were face-to-face. Very few people were doing virtual consults. It was unknown territory and actually probably frowned upon by the medical fraternity. Suddenly COVID came along, and we had to go suddenly virtual. And everyone understood the reasons why. And suddenly also teaching had to go virtual. Now I was quite lucky because I had set up all these platforms at our medical school. I could transition fairly quickly into our hospital by teaching people using either the HoloLens system, which is a mixed reality device, or glass systems, so we could then train people on a remote basis. So during COVID, for example, I was using the HoloLens, which is a big mixed reality device, to do a ward round on the ward, to see patients. Our students weren't allowed to be on the ward. They were socially distanced in the theatre next door or at home, and they could do a ward round clinically with me, so not losing out on clinical experience. So COVID has shown us we need to change, and now there are many companies out there building smart technologies, remote telementoring, teleproctoring devices, using video relays, etc. And now we're seeing it's become much more commonplace. It's not thought to be futuristic anymore. It's normalized because now we're using it to train people, not just on a local level, but on a global level. So yeah, in some ways, I think 10 years ago, I felt that that's where the future was heading towards. We had to disrupt. I guess I was an early innovator, early disruptor, but I think COVID has helped me showcase that perhaps I got one or two things right in about 10 years ago.
And so speaking of 10 years ago, let's actually talk about 2017, and you were making a few predictions about how AI might disrupt. So could you tell me what you were thinking back then and what's actually played out now?
So yeah, I thought AI would certainly become much more part of our lives. And of course, that's becoming true with the introduction of the large language models, etc. When I looked at the whole journey of a patient, I said, okay, what parts of those could AI support and augment or improve? So let's take the first point of contact. If I did a slide for my presentations on this, which I now go back, and I think there was a good correlation of prediction in 2024. The first point, the patient asking the doctor for a diagnosis. So normally it's face-to-face. I made the prediction 10 years ago that the first point of contact in the future would not be a human being, would not be a patient seeing a doctor as a human being. It would be an AI chatbot for triage. So imagine now going to an AI triage or a chatbot, having your symptoms, communicating with this AI chatbot that's intelligent, a back and forth conversation, which then says back to you, hey, your symptoms either worrying or not worrying, this is what we say you should do. Go and see your GP, ignore it, just reassure yourself, or we are concerned. And that's what I see now happening more and more. So first point of contact is taken away. The next point is, okay, say there is a concern for your symptoms, then you might require diagnostics, which is usually a chest x-ray or image or an ultrasound or a CT scan, for example. It takes time to report one of these things. There's a dearth of radiologists around the world, a lack of trained doctors, for example, a lack of radiologists and radiographers. So often there's a long delay in getting that diagnosis. And I remember once, many years ago, when I was I'd come back from the Middle East. I developed a severe cough for quite a few weeks, and I was concerned, so I got chest X-ray. I didn't get the result back for a week, 7 to 10 days. It's a long time when you have a test done, for example. I thought, how could that be improved? I used to think, well, maybe AI, if it looks at it immediately, can spot the differences in the X-ray or the image, should give you a response in your smartphone immediately, saying this is abnormal or normal, or giving you the results straight away. That's what you deserve as a patient. Why should you wait a week when you might be concerned? It might be a possible cancer or something more serious, for example. So the next step of that journey of the patient is the diagnostics. And that is, of course, now happening in real time. Then it's the treatment, for example, or the taking a sample or a biopsy. And I said, what about having a navigation tool to allow you to take a biopsy safely using AI? So for example, you might need a liver biopsy, a lung biopsy. Can we use AI to navigate using the CTs, MRIs, reconstruct those images to allow you to get to the right place? And the next step was, okay, what about the operation? You might need, say, for example, you have a lesion in the lung. You might need a lung removed, for example. So could a robot supported with AI help you do the operation? Whatever that means. Navigation tools, assisting you during surgery, advising you, supporting the surgeon. And then once you've done the operation, that specimen goes off to the pathologist to look under the microscope. Again, there's a dearth of pathologists in the country and globally. Not enough people. And it can take 2, 3, 4 weeks to report a pathological specimen. Again, why should you wait so long? It makes no sense. So that pathology could be AI driven, and then you could get immediate answer. The whole journey could be much faster. At the moment, it takes a lot of time. I often used to use the analogy of how human beings have changed society. We're now the 2-click economy. Almost now it's a 1-click economy. So if you look at websites, you have to do 2. If you do 3 clicks, it's too long. People can't wait. It has to be a 2-click website to navigate through information. It's kind of who we are. Similarly, if you look at where we use other technologies, Uber, for example, the kind of the eating programs, Just Eat, Uber Eats, and Deliveroo, for example, we move very fast. We want rapid responses. So if you go for Uber, for example, and you order a taxi, and the Uber says to you, the nearest taxi is 25, 30 minutes away, you almost lose your mind. Why am I waiting 35 minutes? I could walk it. And you just got angry because you want it immediately 1 or 2 minutes, right? Which is what they expect. But yet in healthcare, we're happy to wait for a week to get a result back. We're happy to wait a week for an appointment to see a GP, for example. We're happy with delays. Yet for Uber, you can't wait more than 2 minutes, or food for more than a few minutes. For healthcare, science has created a system where you should wait. I think we should reverse that. Immediacy, access to your data immediately, empowering the patient, having data at your fingertips on a smartphone for you to make sensible decisions about your life. So if you look at that whole journey that I predicted in 2017, a lot of that now has become true. And we're starting to utilize some of these technologies. It's not mainstream, not for everywhere, but in time it's going to become part and parcel of who we are.
Could you tell me the attitude towards it from clinicians, for example? How are you using it in your clinical setting? What is the attitude towards it from health professionals?
Okay, so if you look at health professionals as a whole, we've been very slow to adopt change. We're notoriously slow. We're resistant to change, and we have been one of the problems in implementing these new technologies into the workplace. We are at fault. I can raise my hand up as a doctor. We are to blame for a lot of the problems. However, we're conservative. We think about things sensibly, about the risks involved, etc., to ensure we have patient safety at the front of our minds. So we are certainly part of the problem. What I've seen over since COVID, certainly, there's been more interest in innovation, more interest in implementing change much faster, and people adopting these technologies. That's changed. That would be much harder 10 years ago. So if you look at the cycle of innovation, the bell curve, at one side you have the 2.5% who are the innovators. They're easy. They innovate, they're going to evoke change. Then there's about 15% or so of the early adopters. Look at the curve. That gets about 17.5% of the curve. If you get to that point, then there's a knock-on effect where most people will adopt change. So the question is, how do we get to that point of around 20% of adoption before we see major changes take place across the healthcare system? Healthcare is under pressure. It's unaffordable. It's inaccessible for a lot of people around the world. And so therefore, we have to think about how do we do it differently? How do we reimagine, reinvent, rethink, remodel, if you like, the world of healthcare? And I travel a lot around the world, visiting various governments and health institutions, and there's one commonality. No one's got enough money for healthcare. There's no extra cash available. So that's the commonality. How do we reimagine healthcare? How do we use the same resources in a different way? How do we use that to make it more efficient? And that means pushing the funds into primary care, into preventative medicine, let patients be more empowered, have less secondary care, less interventions, if you like. Unless you do that from the outset, there's no way we're going to make healthcare more affordable. So I think we've got to repurpose what we know and understand and use resources in a much more smarter fashion. A smarter workforce, smarter way of working, more efficient use of time, using technologies to help and support it, to allow us to reimagine this model of healthcare.
Could you tell me a little bit about patient attitude towards artificial intelligence? Is there a little bit of apprehension or anxiety there?
Yeah, so we have to be very careful when we talk about AI. It scares a lot of our patients. People often talk about things like, AI taking over doctors or replacing doctors, or an AI robot doing your surgical operation, for example, remotely from some part of the world. And that can be quite, I think, scary for patients. I think AI itself has to be thought of assisting and supporting. It's making life easier. It'll support efficiency. It'll improve diagnostics. It'll help doctors make better decisions, have more time for their patients, and also improve their outcomes. That's the narrative we need to adopt to allow us to reassure our patients as we go forward. One of the concerns people had before when AI came in, there was all this buzz around it. Oh, AI is going to take over and do everything. It's not in reality. We can control that. We know where it's going to be useful as we roll it out, to ensure that we have patient safety and to ensure that whatever we implement improves the outcomes. We can do that with science and research and validation, of course we can, but we also got to make sure that we have good regulation and good processes around how we obtain data, structure the data, use the data, and then allow the AI algorithms to work to support patient care. That's the narrative that I would take around AI, to reassure the patients that we're not going to be disappearing anytime soon. It's just the way we work will change, but for the better.
So we've talked a little bit about sort of where we were 10 years ago. I think it would be good if you sort of could talk about how you're incorporating AI into your practice, but also let's touch on the future. Where do we think it's going?
So in terms of AI, we've been very keen on using AI in various parts of our work. So of course, I'm CEO of Medical Realities, which is a XR education company, and we call ourselves AI-powered XR. Although we use virtual reality or augmented reality platforms, we now use the back end of AI, whether it's using ChatGPT or large language models, avatars, etc., to allow us to train people in virtual reality. So we've incorporated AI heavily into our products. The other company that I support, I run a number of companies. Another one is called AI Medis. and we've launched the world's first health metaverse. We actually launched the public only last week, and in fact, our first country we launched was Australia. So we've been building this over 2 years based on Web3 technologies, powered by AI. So now you can enter our metaverse, enter Australia as your avatar, connect with people using AI interfaces, for example, AI conversation engines, and then either have a consultation, have an education class, for example. You could do some diagnostics, you could have some therapy. So for anybody interested, Avalon is the world's first health metaverse that we're really pleased to launch to the public. And I'll be doing some classes within my own university, in my own metaverse, for example. It sounds quite wild, but it's out there and we built it. So that's how we're using AI. In terms of into the medical profession, in terms of clinical practice, I'm not using AI as much. We're not seeing it being used. I think the only use case we're seeing is diagnostics. In radiology, in dermatology, things that require image analysis, where AI has a huge advantage. So those are being implemented as part of a workflow, if you like, to improve access, to improve diagnostics, etc. That's where I'm seeing it being used. We're seeing using it for predictions as well, predicting disease, for example. We're seeing it for using for triage, also for drug discovery, for example. We now have a third drug produced through AI, using protein folding, for example, looking at how the proteins might work, the molecules that might be benefiting, and doing fast-track analysis and drug development, for example. So we're seeing all of these happen. In terms of the future, we know that it's very easy to predict the next 2 years, but impossible to predict the next 10 years. We have no idea what's going to happen in 10 years' time. I think the next 5 years, it's really going to be the fact that we've got these technologies now that are proven, we've got some validation now on it. How do we utilize those in clinical practice more widely? That's the first thing that's going to happen about the future. Secondly, it's how do we think about these technologies and how do we reimburse? That's my question. Bring technology in, how do you pay for it? Who pays for it? That's a question that remains unresolved. And we'll see the much faster adoption, and hopefully we'll see a change into what's called this more personalized care, moving away from secondary care to primary care, empowering patients to look after themselves, using their own data, for example, that's accessible, and we'll see people make decisions around their health. Rather than being sick care, we're moving to what's called well care, manage people's health better. And the whole concept now is lends itself well to the concept of longevity. And what we talk about that is your health span. So there's two concepts to understand with this. There's lifespan, is how long you live. And if you look at the oldest person ever to live, it's a French lady called Jeanne Calment, and she survived to 122. It's the oldest that anybody's ever survived. And probably the oldest anyone that can survive is our biology. That's your health span. So that's your lifespan. Your health span is how long you are well for. The longer you maintain your health, the longer you're going to be healthy for. And if you reduce the distance between your health span and your lifespan to bare minimum, that's the future of longevity. That's what we want to get to. We want to live as long as possible. Yes, not forever, but as healthy as possible. So all of these technologies and innovations will allow us to think, how do we maintain our health for much longer? Preventing comorbidities or manage them better. Ischemic heart disease, the diabetics, for example, etc. Manage in a way that will allow them to live a functioning life for much longer. In the future, of course, we may have, as we begin to have more healthier lives, we'll have maybe 2 or 3 careers. We'll have one career because we're healthy, which is another career, maybe another one. Society will change automatically. Also, in terms of jobs will change because, they say that 70% of all jobs have not been identified yet. We don't know what they are. So the new jobs out there will evolve as we live healthier much longer, as we spend more time on ourselves, and as society changes with technology as the interface, we will see a dramatic change in our society as a whole, but also in healthcare systems. I don't think you can take healthcare away from the society as a whole and where we're heading towards. So that's where we kind of the future lies. And technology becomes one part of it. It's important for people to understand that technology isn't the answer for everything. It helps us, it supports us, it augments our work, it helps us innovate, it allows us to rethink the model, but it's not the answer. The answer is human beings, how we interact, how do we adopt, how we change, and change management is going to be crucial for all of us in terms of the future to acknowledge these new ideas, to implement them into our clinical practices, to allow us to think better and perform better.
So I guess it's not necessarily about this whole concept of never dying, but rather just living longer, healthier lives. We might just touch a little bit on this metaverse, because it sounds like it's tapping into that concept of educating people on a global scale. Could you tell me just a little bit more about that metaverse, just to finish up?
Yeah, so when Mark Zuckerberg talked about the metaverse and changed the name of Facebook to Meta a few years ago, we'd already been working on our concept metaverse. So when you ask people what is the metaverse, and I ask this question a lot to audiences around the world when I give my keynotes, they often have an understanding of a headset, and that is kind of somehow the metaverse. It's much more complicated. John Radoff talks about the 7 layers of the metaverse. It talks about the computing required for it. The access point, is it a smartphone, is it a headset, is it a computer interface? It's the environment that you're in, the worlds that you create, and what's the interaction going to look like. So what we've built is a metaverse called Avalon, and it's based on Web3 technologies. Look, we are in Web2 at the moment. Web2 is a centralized platform where those big companies own our data. And Web1 was going back to the old days of AOL, for example, and 56K modem, that kind of thing, right? So Web2 is where we are. Web3 is that future of a decentralized platform where we own our own data. If you still look at the metaverse as a whole, there are a few companies out there who've built some metaverses, but they're really quite not very good. There's Decentraland, kind of this big land that was built about 3 or 4 years ago, and people like Nike and other big stores were buying land, for example, and real estate in the metaverse because they thought this was the future. But it didn't really pan out because it was about the experience and the use cases. So when we build our health metaverse, it's based on Web3. So we're using AI and deep machine learning at the back end. We're using our own kind of blockchain to build it. We have our own coin that we've used for a number of years called the IMX token, because how do you interact, how do you buy things in this world, right? So you have to have your own token. We've been using cryptocurrency for a while to think, how does that work? We built it around your own avatar, creating your own personality experiences. But it's not just on a VR headset. It's available on a VR headset. It's available on a smartphone. It's available on a desktop browser. So you can interact with this environment. And we see it replacing our virtual world. The virtual world we created is using an engine called Unreal Engine 5, which creates photorealistic worlds. So we've created Australia, we've created Japan, the Middle East, Dubai, Switzerland and Austria, and we've launched a lot of those already. So you literally have your avatar, you walk in, you can access a doctor who might be there as an avatar in his clinic space. You might be able to go to a lecture who's given by some professor from anywhere in the world, for example. You can go get some therapy. You can have some mental health training. You could go to somewhere, you could have some time to kind of relax, for example. And perhaps do some mindfulness. So this world that we live in is incredible. And the metaverse term actually comes back from a book in 1992, a book called Snow. I'm trying to remember the word now. I completely forgot the word. So it's a book from 1992 where the book describes a dystopian world where people in the real world were escaping reality because of a dysfunctional government, because of financial meltdown, societal breakdown. It's called Snow Crash. That was the book. And they were escaping into a new world called the metaverse. That was the first time that term was coined. And so the metaverse is much more than just a VR experience. So yeah, so if you're keen, you should sign up to Avalon AI Medis, go to the platform, and then you'll see what we talk about our experiences.